Soledad O'Brien was born in 1966 in a small town called St. James, located in New York. She attended Harvard University and graduated in the year 2000, and she received her bachelor's degree in English and American Literature. O'Brien began her career in journalism as a medical reporter on KISS FM in Boston because of her background as a pre-med student in college. Then in 1991, she began working for NBC as an anchor. Later in 2003, O'Brien left NBC and joined CNN as the co-anchor of the network's flagship morning program, American Morning. She is most known for her coverage of Hurricane Katrina, her show Matter of Fact, and for being the executive producer and host of her newest show, Disrupt and Dismantle, where she tackles systemic racism head-on. Soledad O'Brien is labeled as controversial. However, she discusses issues that the majority are afraid to have conversations about. She asks the public, what are we going to do to disrupt the system? O'Brien's show Disrupt and Dismantle provides the start of solutions to many issues surrounding Black and Brown communities, such as Black maternal mortality rates, unequal healthcare, and the future of police reform. During an interview with Kelly Clarkson, Soledad emphasizes that Black women are 3 to 4 times more likely to die in childbirth than a white woman.
One of the episodes focuses on infant mortality, so can you tell us more about that?
Yeah, if you look at the disparity between Black women and white women when it comes to maternal mortality and infant mortality,
I actually have heard of this.
the numbers are terrible. Black women are 3 to 4 times more likely. 3 to 4 times more likely to die in childbirth.
Yeah.
It's crazy. So we wanted to understand that. And what you really see pretty clearly, pretty quickly, is that there are these sort of racial and systemic racism that sort of influences outcomes for women and also their infants as well. The infant mortality numbers are terrible too. And so we wanted to explore what was happening around infant mortality. The stories are terrible, and they go from women not getting good access to health care, women living in healthcare deserts where they're just not anywhere close to good places to get health care, and also a lot of Black women reported doctors just not really listening to them. There are lots of studies that say doctors and others believe Black women have a higher tolerance for pain. So we were really interested in exploring, well, what exactly is involved? Sometimes it's just access to better systems around funding for healthcare, et cetera, et cetera. So we looked at...
Furthermore, Soledad reveals in an interview that the city of Chicago has paid out millions of dollars to cover up police misconduct. She discloses an incident that occurred with Anjanette Young, a woman who feared for her life as she was handcuffed naked during a mistaken raid.
We have to talk about the idea of the thin blue line. What exactly is that?
I think there's a sense that the police will support each other, always, through thick and thin. And actually, what we were doing in Chicago, right, was talking to a woman named Anjanette Young. She was a woman who was naked for about 20 minutes while the police performed a raid on her apartment. They were in the wrong apartment, right? But in both
And
of
she
those...
kept trying to tell them that they were in the wrong apartment.
And they told her to relax.
They tore down a door with a battering ram.
Right,
so
they knocked in her door.
that is already incredibly violent. They offer her no assistance.
They handcuff her, hands behind her back, and put a jacket over her shoulders, which of course keeps falling off because she's handcuffed. I mean, talk about just feeling like, wow, no one even sees me as a human being standing here. I'm standing here naked. There are people in my apartment searching for a guy who's not here. And there's not a soul who says, let's let her get dressed. Let's put a shirt on her. That, I think, was incredibly upsetting for her.
Yeah. I know that you've seen horrific things over the years of your career, but why did that interview really get to you?
A lot of these stories across the board that we're doing in these series, right, are seeing people as less than, especially if they're poor, especially if they're Black. And she said to me, I know if this were a white woman, this never would have happened. And I do not disagree.
Former Chicago Mayor Lori Lightfoot did not fight to have the body cam footage released to her, and her team also tried to stop the local news media from talking about the case. Soledad believes that in many of these cases, it's not about an individual. These systems are often the status quo, and they come from the Jim Crow era. They come from slavery and the roots of slavery, especially policing. Issues like this are not only present in policing, but in the medical field as well. African Americans are not prescribed medications because doctors believe that they will sell it or that they don't feel the same amount of pain as the average white individual.
Doctors not prescribing pain pills to African Americans because they believe they're going to sell them, or they believe that black people don't feel pain at the same levels that white people do, or just in general, they don't actually want to help their black patients with pain. All these things, there's a fair number of studies on all of them. So, for example, an African American who goes and gets wisdom teeth pulled will not get the 90-day supply of Vicodin that a white person who has a really good Blue Cross Blue Shield coverage, they'll get, as my girlfriend did, 6 pills and, told, listen, if it's really bad in 2 days, come back and we'll pre-prescribe.
The National Institutes of Health states that Black Americans are systemically undertreated for pain relative to white Americans. Whether one receives the standard of care that they expect is likely contingent of their race or ethnicity. Prior research suggests that if the patient is black, then the pain will likely be underestimated and undertreated compared with if they are white. She and her husband, Bradley Raymond, founded the Soledad O'Brien and Brad Raymond Starfish Foundation. O'Brien and Raymond had given 6 girls in New York, California, Florida, and Louisiana the opportunity to attend the high school or college of their choice. In 2005, she covered the aftermath of Hurricane Katrina in New Orleans, where she interviewed then head of the Federal Emergency Management Agency, Michael Brown. In the wake of Hurricane Katrina, O'Brien and her husband created the powerful foundation to help young women get to and through college. They have since expanded to support over 4,000 young women and girls in their academic, personal, and professional journeys. Soledad won her first major journalism award, a Peabody, for her coverage of Hurricane Katrina for CNN in 2005. She was honored twice with the George Foster Peabody Award for her reporting on the BP Gulf Coast oil spill as well. O'Brien was recognized with 3 Emmys for her coverage of the Haiti earthquake, the 2012 election, and a series called Kids and Race. Soledad continues to be an inspiration to many young women across the country. She deserves much more recognition than she receives and is a powerful young woman who continues to give and support her community.